Hi everyone, my name is Aurora Lucas, and I am presenting this information because I believe that it's one of the many solutions to the health disparities we have today. I am a lung cancer patient. I'm also a fourth year PhD student, and a lot of my research goes into patient advocacy and the inequalities happening in the healthcare system. But anyways, on to this. If you've landed on this video, you must, or you're probably um, in the process of learning more about lung cancer, or you already know a lot about lung cancer, or you are a patient that is experiencing symptoms. So if you are a patient experiencing symptoms such as back pain, a cough that won't go away, coughing up blood, joint pain, bone pain. There's a lot of symptoms attached to lung cancer. And here are some practical steps in order to go and get yourself checked. I want you to prepare before you go and get yourself checked. Okay? So, advocating for yourself in the emergency room when experiencing lung cancer symptoms can be really challenging, but it's very critical for receiving timely care. Number one is clearly communicate your symptoms. So, what symptoms do you have? Use precise language to describe your symptoms. Emphasize any red flags such as persistent cough, chest pain, shortness of breath, unexplained weight loss, or coughing up blood. Another one is like extreme fatigue. For me, I couldn't even drive home after work. I would like fall asleep on the wheel right when I was done with work. I needed to start getting picked up by my husband, and I was only 28, so that was not normal at all. So highlight the duration of progression of your symptoms. So when did your symptoms start and did it start getting worse? Please be able to know how to explain this. Because a sense of agency is something that they're not going to immediately have in the emergency room, or your PCP might have. Remember, these people are used to trauma and they're very used to very extreme circumstances. And if you look healthy, you look good, I don't know if they're going to give you that sense of agency. Number two is mention any medical history. If you share relevant risk factors such as, did anybody in your family ever have cancer or lung cancer? Do you know if you have exposure to radon? Any smoking history possibly, or occupational hazards? So explain how your symptoms align with your prior diagnosis or risk profile. I fall in the category of not really having risks. They thought it was tuberculosis or pneumonia, so this may only apply to some people. So request specific tests. So you have the right to politely but firmly request a CT scan by saying something like, hey, given my history, I believe a CT scan could provide critical insights into what's going on. Can we explore that option? It's okay to ask for those things. The worst they could say is no. But I think that if you had the right language, the right positionality, you could very much go and get a CT scan. So if you can, try to use medical terminology because this is the language of the healthcare workers. Even though they're supposed to be able to talk to us normal people, using medical terminology also gives you a step up in knowing what you are talking about. So reference possible differential diagnosis such as pleural effusion, lung mass, pneumonitis. These are things I couldn't say, but I was able to bring an aunt who was a nurse to reference possible differential diagnosis and to like tell them what kind of urgency they needed to have. That was 3 months after the initial visit, by the way, that people started coming with me to the appointments. If you can, you could say my symptoms could indicate pleural effusion or a mass, and I believe a CT scan could help rule those out. So cite clinical guidelines if you're familiar with them. For instance, the American College of Radiology often recommends CT scans for evaluating persistent or severe respiratory symptoms in at-risk populations. Also, by the way, this video is for us that do not meet the lung cancer screening guidelines, which is you have to be over the age of 50 and have a 20-year smoking history. So many people do not even meet these guidelines, and that's the kind of audience I'm trying to talk to. If you don't meet those screening guidelines, there are ways for us to still be taken care of. So express your concerns, right? Share your fear of delays due to the high stakes of lung cancer. For example, you could say, hey, I've read and learned about how delays in imaging can lead to worse outcomes in lung cancer. That's my concern right now. You can say that lung cancer isn't diagnosed until stage 4, which makes treatments less effective than if they were diagnosed early. I think being able to name these fears and concerns will actually help you look like an advocate in the emergency room. So bring documentation. If you have access to your medical records, prior imaging results, or test reports, share them to provide context. I needed to start bringing around the CD that had like my CT imaging, because sometimes the different hospitals didn't have records of my images, right? Because they were different institutions. If you got like a CT scan before, but they're not letting you get a PET scan because of insurance or whatever, that CD is life-changing, right? You need to always have that around. And bring a written summary of your health history, especially if it includes prior lung cancer diagnosis or treatments. And then I think this is super important. If you don't have anyone in your family or friends, please ask for an advocate, such as a social worker or patient navigator, if they are available in the ER. If not, we gotta be our own best advocate, y'all. Bring your family member, bring your friends. Please remember to be polite because these people are trying to work, but you're also trying to save your own life. So it's a dance between the two. And here, involve a family member or a friend who can echo your concerns and help articulate your needs. Because if you're experiencing those lung cancer symptoms, chances are you're probably traumatized from insurance, life circumstances, and whatnot. If there's a family member who could help ground you and help you in the emergency room and articulate your needs, that would be super helpful. Do not be afraid of looking rude or impolite for asking for things. These are things that will help actually save your life and preserve your quality of life as well. You are not rude for asking what you need. So, if the attending physician is hesitant, and I've met a lot of these attending physicians, some even prayed with my husband, praying it was not cancer, but ask if a pulmonologist or oncologist could be consulted. Ask. It's okay to ask for things. So, for example, you could say, would it be possible to consult with a pulmonologist or oncologist for their input on whether imaging is appropriate? So, humanize your situation by sharing your story. I'm really worried because of my history of lung cancer. Or you could say, I'm really worried because of my history with these symptoms and they just keep getting worse. I want to make sure nothing is missed so that that could jeopardize my health. And then, super important, politely remind the staff of your right to advocate for care. You could say, I understand you're busy, but I feel strongly that a CT scan could help identify the cause of these symptoms and guide my treatment. I think this is like the golden thing, starting from being polite, but saying, I understand you're busy, but I feel strongly that a CT scan could help identify the cause of my symptoms that aren't going away and actually hopefully guide my treatment. I think that is brilliant. So, there is a high chance of your concerns being dismissed still. Ask to speak to a patient advocate or the ER supervisor. One of my friends, my dear, dear friends, had to do this after being in and out of the hospitals for about a year due to her symptoms. But you are allowed to ask for a patient advocate or the ER supervisor. You're able to escalate the situation. I just put keep your tone firm yet respectful. I feel my concerns aren't being addressed, and I'd like to escalate this to ensure the best care possible. Also, as you're doing all this, please document it. I was too like traumatized and in pain and being in denial during this whole process, but I think there's a big difference with documenting everything, whether it's even like filming yourself, telling us like what time of the day it is. It's just, it adds on to your evidence of symptoms. I know we shouldn't be doing that, but that's just like the state of the world, like the state of the healthcare system in the United States right now. We got to document everything. So advocacy requires persistence, but combining clear communication, medical reasoning, and empathy often helps ensure your concerns are taken seriously. Those people in the ER or hospitals are also human and exhausted and burnt out, but you need your care. You need to get answers of why you're having symptoms such as chest pain. Um, I don't know, maybe you are getting misdiagnosed over and over again with pneumonia or tuberculosis, but the symptoms just keep getting worse, right? So there's a list of why they may be burnt out or dismissing you, but you deserve the right care. You deserve to be seen. You deserve answers. So if you are in the hospital right now looking for answers, I hope that these slides help. Please comment below if you have any questions of needing to advocate for yourself. You deserve the best care possible. You deserve to be seen and to be given answers. Thank you.